Even during a pandemic, stroke is a life-threatening medical emergency, and health officials and medical groups across the country, including the American Heart Association, are urging people to seek immediate medical attention. Joining me to talk about it and with the signs and symptoms, world-renowned stroke expert Dr. Patrick Lyden, professor of neurology at Cedars-Sinai, Los Angeles. Thank you so much for being here.
Thank you for having me.
COVID, I understand, is keeping people away from the emergency room.
Yeah, so we're all afraid of acquiring the virus. It's out there and we can catch it in a restaurant or in a large meeting hall. So the emergency department is taking precautions. We mask and gown. If you come in with a stroke or a heart attack, the first thing we do is put a mask and a gown on you. So it's one of the safest places you can be. But the emergency department is where we can treat you if you're having a stroke or heart attack. It's the place to be.
Well, if folks are afraid to come in, it's probably because they're afraid of getting COVID. How soon after you arrive in the emergency room would they actually put a mask and gown on you? And what's the procedure, say, if someone is transported to the hospital by paramedics?
Absolutely, absolutely. In fact, most patients, when the paramedics arrive, the first thing they do is put a mask on the patient. So you'll be protected from the moment the medics arrive. They will be wearing masks and appropriate PPE as well. So it's one of the last things you want to worry about. What you want to focus on is if it's a stroke, minutes matter. Time is brain, and we need you to be in the care of the paramedics and brought to the emergency department where we can start to assess you and treat the stroke.
So strokes are fairly common. Who's at risk?
Stroke is very common. It's the leading cause of disability. More people are in nursing homes due to stroke than any other cause. So it can occur at any age. It does happen to be more common in the elderly or patients that have high blood pressure, diabetes, high cholesterol, but it can occur in young people as well. In fact, it's rising very quickly in the population 20 to 40 years old.
And why do you think that is?
Well, we're not sure. Among young people, there is a higher incidence of stroke risk factors like migraine, injuries to the carotid artery, drug use, and sometimes it's just due to high cholesterol or high blood pressure occurring at a younger age.
What are the signs and symptoms of a stroke?
So remember, stroke occurs when part of your brain suddenly stops working. So when part of your brain stops working, part of you stops working. So sudden onset of something like face weakness or speech loss. And we have a mnemonic to help people remember. It's called FAST, F-A-S-T, face, arm, speech, and time. If the face is suddenly drooping on one side, or the arm is suddenly drifting on one side, or the patient is suddenly slurring their words, it's time to call 911. It's time to go to the hospital, FAST.
Well, a lot of people are also still sheltering at home and socially distancing. And there's an older population, of course, who are by themselves. What should they do if they think they might be having a stroke?
Well, I mean, people who live alone and have stroke risk factors ought to have some kind of device that they can use to call for help. But it's also critically important that we check on each other, that we are checking in. One of the problems with stroke is that the brain is what you use to recognize there's a problem. So if the problem's in the brain, you're going to have a harder time recognizing that something is actually wrong. So it's important to check on each other and just watch out for each other.
And what can people do to reduce their risk of having a stroke?
The most important thing, more powerful than all the surgery and medication in the world, is to quit smoking. If you smoke, the best thing you can do to lower your stroke risk is stop. If you have high blood pressure or diabetes, take your medications. Take something to lower your cholesterol. If you have a little bit of extra weight, try to lose that. You know, it's a cliche because it works. Diet and exercise are powerful ways to prevent stroke and heart attack.
After you're admitted to the hospital and you're diagnosed with a stroke, what treatment options are available?
Absolutely. So first of all, not everything that looks like a stroke is a stroke. Sometimes it's a seizure or low blood sugar. So it's important that you be evaluated for all the other things that can mimic a stroke. If it is a stroke, we have medication, we have surgery, we have things we can do to treat that stroke in time. Remember, minutes matter, time is brain.
So For instance, if you're having a stroke, are there warning signs that people should pay attention to, say, maybe days before having a stroke, or does it just happen suddenly?
There are so-called warning strokes. These are brief spells that can occur and last a few minutes up to an hour. And these can occur before a major stroke. So if you have something that sounds like what we're talking about today, sounds like a stroke, but it doesn't last very long, call your personal physician and get evaluated for that. That could be a so-called warning stroke.
I understand that some healthcare professionals think that COVID-19 is actually a bloodborne disease that impacts your system and wreaks havoc. Is there any connection between COVID-19 and strokes?
Yeah, that's really interesting. You're right. The virus does affect how the blood clots, how the blood functions, and that could lead to a stroke. We've certainly seen COVID-19 patients who were young and didn't have other stroke risk factors and who did come in with a stroke. But we're still collecting data. It's still very early in this. We don't know this for sure yet. Right now, it's a suspicion, and we're watching it carefully, collecting a lot of data around the country. So we don't know for sure yet, but the bottom line is any age, COVID or not, if you think you're having a stroke, call 911 and let us decide what's going on.
Right. Don't play doctor and try to self-diagnose.
Don't play doctor at home.
And where can we go for more information about the signs of stroke and the symptoms?
So the American Heart Association, American Stroke Association maintains a website called stroke.org, stroke.org. It's full of information about what is a stroke, what causes a stroke, how you can prevent a stroke, and it's updated every day with information about COVID-19. There's also strokeawareness.com that's full of information that would be useful to you or your family.
There you have it. Be sure to check with your healthcare provider if you think you're at risk and or you're having a stroke. My guest has been Dr. Patrick Lyden. Thank you so much for joining me, Doctor.
Thank you for having me.
There's more to come on Talk with Audrey. I'll be right back.